One of the biggest challenges we as fertility specialists face is not just treating infertility, it is also correcting misinformation. Every day, couples walk into our clinics with beliefs that they have heard from their friends, the social media, family, or the internet. Some of these myths might seem harmless, but in reality, they actually might be postponing your diagnosis, postponing the treatments, and also reducing the chances of a successful pregnancy. So let us today talk about some of the most common fertility myths that we hear in our daily practice, and also let us discuss what the science actually has to say. Hi everyone, I'm Dr. Maunica, working as a fertility specialist at Ferty9 Hospital, LB Nagar. Myth number 1. Infertility is always a women's problem. This is probably the most common myth that we often hear. Actually, infertility is a couple's condition. In nearly 40 to 50% of the cases, the infertility causes might actually be the male factors alone or sometimes in combination with the female factors. Hence, please do not forget that pregnancy is a journey of the couple. Both the partners need to get evaluated simultaneously. Now, myth number 2. If I have regular periods, I can't have any fertility problems. Now, this is another common myth that we do often hear. Regular periods is definitely a positive sign, but that does not tell the complete story. In spite of having regular cycles, the lady might be having some underlying medical conditions like blocked fallopian tubes, endometriosis, unexplained infertility, or sometimes there can be coexisting male reproductive health issues as well. Hence, even if you have regular cycles, if the pregnancy is delayed, proper evaluation is of utmost importance. Coming to myth number 3, doctor, we are young, we can still wait. So this is another statement that we get to hear on an often daily basis. So wherein the couple says, doctor, we are just 27, 28 years old. We would like to try for another 2 to 3 years. What's wrong in that? But age is not just a number when it comes to infertility. In terms of female fertility, it declines with increasing age. We see a decrease in egg numbers as well as the egg quality. Similarly, the male fertility also declines with advancing age. Hence, without having proper knowledge about your fertility status, just postponing the pregnancy or the plans for evaluation is not the right way to go. Myth number 4. IVF is the only treatment that fertility doctors recommend. Now, this is actually one of the biggest misconceptions. Most of the couples are actually hesitating to visit the fertility clinics because they assume that they will be advised to undergo an IVF treatment invariably. That is totally not true. Most of the couples sometimes are only advised lifestyle alterations. Some are treated with simple medications. Some might require smaller treatments like IUI. It is only selected few who are advised IVF. So the mode or the type of treatment that is advised to you is totally dependent on your profile and your diagnosis, and it is not just based on assumptions. Myth number 5. Healthy looking people do not have any kind of fertility problems. Many of the couples, they often state to the doctors that, doctor, we eat healthy, we often exercise on a daily basis, we do not smoke or drink, so why will we have any kind of fertility issues? But when it comes to fertility, the appearance is not everything. Numerous medical conditions like blocked fallopian tubes, endometriosis, low ovarian reserve, or sometimes even male factor infertility, they do not have any visible symptoms. Hence, what is more important is evaluation rather than just going by appearance. Myth number 6. Someone in my family conceived after many years, so we will also just wait. This is also quite common, where couples tell us like they have different stories. My sister conceived after 5 years. My cousin also had a delayed pregnancy, so we would also like to just wait. Now, family history is not your diagnosis. And the reason for delay in pregnancy in one couple, the story might be very different from yours or any other couple. Hence, just waiting based on somebody else's experiences is not the right thing to do. Always prompt evaluation to know your diagnosis is always advisable. Myth number 7. Google knows my fertility problems. Internet is a wonderful place to learn, but it should not completely replace medical evaluation. The same symptom can have numerous diagnoses. For example, a lady who is suffering with irregular menstrual cycles, the underlying cause can be numerous. It could be a thyroid issue, it could be PCOD, or it could even be a declining ovarian reserve. So using internet should only be to create awareness but not for self-diagnosis. So what's the biggest takeaway? Most of the myths don't just create confusion, they actually delay action. So instead of relying on these groundless myths, social media advises, choose facts, choose evaluation, choose evidence-based care. Because every person's fertility journey is unique and every couple deserves the guidance based on science and not just based on assumptions.